Alrighty, so this is the finishing product. So first we have the sternocleidomastoid muscle that originates at the clavicle and the sternum and inserts at the mastoid process up to the temporal bone. Next is a trapezius that originates at the external occipital protuberance and superior nuchal line, and then it inserts on the clavicle and scapula, which we did not need to label. The occipital belly of the epicranius originates at the occipital bone and the mastoid process, and then it inserts at the epicranial aponeurosis. And then the frontal belly of the epicranius originates at the epicranial aponeurosis and inserts at the skin of the eyebrow and root of the nose. The orbicularis oculi originates at the orbital rim, nasal process of the frontal bone, and frontal process of the maxilla, and inserts on the lateral of the eye. The corrugator supercilii originates in the supraorbital region and then inserts at the eyebrow. The orbicularis oris originates encircling the mouth and inserts at the commissure of the philtrum. The buccinator originates at the alveolar processes of the maxilla and mandible and pterygomandibular raphe and inserts at the commissure. You can see this right here and right here. The risorius muscle originates at the masseter and inserts at the commissure. The levator labii superioris originates at the infraorbital rim of the maxilla and inserts at the upper lip. The levator labii superius alcanesi originates at the frontal process of the maxilla and then inserts at the olive of the nose and the upper lip. The zygomaticus major originates at the zygomatic bone and then inserts at the commissure. This is the zygomaticus minor, and it originates at the zygomatic bone as well and inserts at the upper lip. The levator anguli oris originates at the canine fossa and inserts at the commissure. The depressor anguli oris originates at the lower border of the mandible and inserts at the commissure. This is a depressor labii inferioris that originates at the lower border of the mandible and inserts at the lower lip. The mentalis originates at the mandible midline and inserts at the chin. And then right here is where the platysma inserts at the lower border of the mandible and muscle around the mouth. The masseter muscle originates at the zygomatic arch and inserts on the mandible right here at the outer surface. The temporalis muscle originates at the temporal fossa and inserts on the coronoid process of the mandible. The medial pterygoid muscle originates on the medial surface of the lateral pterygoid plate, and then it inserts on the angle of the mandible, which is right there. And then the lateral pterygoid muscle originates on the greater wing of the sphenoid and lateral pterygoid and inserts on the pterygoid fovea in the TMJ capsule. The anterior belly of the digastric muscle originates at the intermediate tendon on hyoid and then inserts on the symphysis of the mandible. And then the posterior belly of the digastric originates at the mastoid notch and inserts at the posterior or the intermediate tendon on the hyoid. So right there. The mylohyoid muscle originates at the myohyoid line and inserts at the hyoid. The stylohyoid originates on the styloid process and then inserts on the hyoid bone. The geniohyoid originates at the genial tubercles and then inserts again on the hyoid bone. The sternothyroid originates at the sternum and then inserts at the thyroid cartilage. The sternohyoid originates at the sternum and then inserts at the hyoid. The omohyoid inferior belly originates at the scapula and inserts at the superior, and then the superior belly originates at the inferior belly of the omohyoid muscle and then inserts up at the hyoid bone. The thyrohyoid originates at the thyroid cartilage and inserts at the hyoid bone. The genioglossus originates at the genial tubercles and then inserts on the tongue and the hyoid as well. The styloglossus muscle originates at the styloid process and then inserts on the tongue. The stylopharyngeus muscle originates at the styloid process and then it inserts at the lateral and posterior pharyngeal walls, which we did not label. The superior pharyngeal constrictor originates at the hamulus and the mandible and the pterygomandibular raphe and inserts at the median pharyngeal raphe. So the middle pharyngeal constrictor originates at the hyoid bone and then inserts at the median pharyngeal raphe. The inferior pharyngeal constrictor originates at the thyroid and cricoid cartilage and inserts at the median pharyngeal raphe. The palatoglossus originates at the median palatine raphe and then it inserts on the tongue. The palatopharyngeus originates at the soft palate and then it inserts at the laryngopharynx and thyroid cartilage, which we do not have labeled. The levator veli palatini originates on the inferior surface of the temporal bone and inserts at the median palatine raphe. The tensor veli palatini originates at the sphenoid bone and then it inserts at the sphenoid bone as well in the auditory tube area. The muscle of the uvula originates at the posterior nasal spine and then it inserts on the uvula. The pterygomandibular raphe runs from the hamulus to the myohyloid. The median pharyngeal raphe runs from the pharyngeal tubercle to the posterior wall of the esophagus near C6 vertebra. The median palatine raphe runs from the uvula to the incisive papilla, and then the intermediate tendon of the hyoid bone is attached to the hyoid bone and then joins the anterior and posterior bellies of the digastric muscles. This is the TMJ cap, and then the TMJ ligament runs from the articular eminence to the capsule, and then the sphenomandibular ligament runs or is located on the medial side of the mandible and runs from the spine of the sphenoid bone to the lingula of the mandibular foramen. And then the stylomandibular ligament runs from the styloid process to the angle of the mandible.